you take for granted that when you push that lever and it just works.
Yeah.
Until it don't. Nothing's worse than flushing and watching the water slowly rise higher than it should. And you're like, oh no.
Help me with hip-hop. Let's get it right. Protect your patience. Day and night. Donna and David, the experts on your side. Help me with hip-hop. Let's get it right.
All right. So last week we had a couple things come out. One, the HIPAA Summit 2026 that Donna attended. And then Nick Heasters dropped a video from OCR. So we're going to talk about both of those today. Lot to cover. Let's dive right in.
Yeah, we're not even hitting on all. I mean, the HIPAA Summit is huge now. I mean, 4 full days, and there's so many things, and they're switched to the pre-recorded kind of format. But it's always interesting to sit in on that because you really start to see, and you can see over time how things have changed. Mm-hmm. And this year it was like a whole day was every session had to talk about AI. And we all joked about it it was a joke a few years ago. Well, we've got an obligatory talk, but now you literally have to include it in every discussion. Mm-hmm. And that was interesting to see. And there was a lot of sessions that were specifically about AI. So we'll deal with that in a separate episode. This one, I wanted to talk about what we learned from OCR specifically, since that is really, where the setting the direction and what we do with our time, instead of twiddling our thumbs, so to speak. But it's a interesting session with Paula Stannard. I'm going to go with Stannard. I should have paid better attention. Yes.
Yeah, we'll go with
that. She's the new director of OCR, and it was interesting that she was when she was talking at the beginning that she is on her 3rd different job inside HHS. Has been involved in all the regulations. She's also worked in a CE's business, and I don't know whether she's an attorney or a consultant, but she also then worked with clients that were her clients. So she's seen all the different viewpoints, which is interesting because I don't know. They don't know that there's been anybody that's taken this job that understood as much as she did coming into the job. So she's like hitting the ground running, like everybody else is having to learn a lot. And so that's good news because, we need some of these things resolved. And so she went into a discussion about how OCR has to address civil rights in healthcare, and that includes HIPAA enforcement, but it could be other things that have nothing to do with HIPAA. And they now also have to enforce the substance abuse privacy controls, which is known as CFR 42 Part 2. It's just known as Part 2. So they have a lot of different things that they have to worry about. And she even pointed out how AI goes across all of them. It impacts all of them. Mm-hmm. That AI could be a separate individual rights issue just by itself and have nothing to do with HIPAA. Yep. You get into the biases and the things that could happen. So it was pretty interesting hearing her kind of tie all that together. And she had on her slide, and I thought this just interesting, so I made sure I put it in here exactly. OCR's HIPAA portfolio vision. David saw that, and he's like, what are you talking about? No, that's her slide. That's what she called it. And she's saying we need to be agile and strategic. We need to execute high-impact enforcement for maximum impact and build resilience through compliance. That our objective with compliance is to make us safe, secure, protect patients, and also be a resilient critical infrastructure.
You mean it's not just a burden and a cost center?
And she did bring that up. It was pretty interesting. She went through several other things. Now we're gonna focus on some privacy and security specific things, but they did discuss the part 2 merging and alignment with HIPAA, and she discussed the parents' access to a minor child's records, which was a dear colleague letter, which always is creepy to me. Dear colleague, I'm writing to tell you what you should be doing. But, and that came out in December during the holidays, and I realized, with all of the stuff going on, we never really went through it. I didn't spend any time on it because, other things came up. So we may have to go back and revisit that. But the more important part was where she started, covering the NPRM, and we have to say that anything about dates and status, those are my opinion, because she was clear. I can't tell you anything about the things because we haven't finalized them, right?
Mm-hmm.
But she would tell you things. And so, having been in this business a day or two,
read between the lines.
I'm gonna venture out there and make a guess as far as what I think, and it's more of a swag, and if you know what swag stands for, scientific.
Yeah.
Wild. Anyway, the big thing that she started on NPRM wise was the privacy, and she pointed out that it's been sitting out there. It had comments finished in 2021.
Wow.
So 5 years ago, and there were 1,400 comments. We feel pretty sure they've gone through those. But she was like that it is noted in the spring agenda item online, which we've talked about, that it has May is when the final is going to come out. And, she kind of ventured a little bit further with that, saying but not saying. I'm not able to discuss the specifics of what we're looking at or what we may or may not implement based on the comments, all of the let me blow some smoke all over the place before I lay down some information so that you don't get a clear picture, because I can't give you one. But she pointed out a few things. One, she made a big deal, pointed out how it would, reduce the administrative burden. And yes, it is a great thing, but when I look at the administrative burden of HIPAA, this has been built in for so long. It's one of the few things that gets actually done, which is getting the patient's signature and keeping up with them. I mean, that's just done with the other paperwork. And if you get rid of that, it's just one less piece of paper, one less signature. It doesn't, they're still doing that work, because there's all these other things that they're getting and they're having to track. And, having, just gone with my dad to one of his appointments at a new place, and it was like, no, Dad, I'm going to need you to sign right here. And he's like, I thought I already signed that one. No, we're going to sign a different one that looks like the one that you just signed, but you're actually signing something different, but they do look exactly alike. It's just that much. And so it was just one signature that would have been left out. It was when I was going through it. But still, it's, get to hang our hat on. We reduced the regulations, which is great. It's one less thing. But it does mean that you got to make all these changes to the NPP, and you have to post it and do some things to make up for not getting those signatures. So I don't know. She did go into the importance of the coordination of care and social services and all of those things, which are in there. I was glad to see that she didn't make a point of pointing out the 30-day to 15-day window for right of access, which is in there. And I believe that you should shoot for 15, because that gives you plenty of time with the 30-day window. And then you're good. but that the NPRM said we're going to reduce 30 to 15 days. That's, whole big different story.
Yeah.
And yeah, that is big. But she didn't bring that up. But she did bring other things up, which was promising. But she did go through several of those areas. And then she also talked about the Right of Access Enforcement Initiative. She says that they received many complaints alleging denial or no access to records. And we've heard they get a ton of complaints on this. Now, I am aware of multiple cases where I had to help clients deal with the fact that it wasn't a failure or a denial, but they were getting investigated. It's one of those where they make the request online and then call to ask you, 2 minutes later, they're calling to ask if it's done.
Yeah. It's been 24 hours. I'm filing a complaint.
Yeah. And there's a lot of things. And, we've had cases like that. But then there are cases where it is actually that patients aren't getting the proper access. Otherwise, we wouldn't have the 54 enforcement actions that they've had. 54.
Wow. That's crazy.
Yeah. And that December memo about parent access to minor child records, there will be a new focus on the parent being a personal representative access, or, that whole discussion. So now they're looking for those cases to be able to make those. We'll see those as the new enforcement initiatives. I think it's a new focus of the Right of Access Enforcement Initiative. Yeah. So, yeah, heads up, folks. It's always the hardest to deal with is those family things.
Yeah. Well, that especially hits, blended families, step families, and, divorced peoples and all that. Who's got the right to make decisions? How dare you take the child to the doctor? All kind of stuff. I mean, I dealt with some of that, and I had full legal custody. So, I did have the right to override, but it's, from the healthcare provider's perspective, it's like, how do we navigate this? And am I walking around with my papers all the time? Like, here's my divorce decree and here's the thing. And then, it puts them in a situation where it's like, look, we're not like attorneys and we're not judges and we're not anything. I mean, we just want to provide care, but now we're having to try to get into the middle of some kind of divorce case or something.
Oh yeah. I mean, that was one of the discussions we had in one of the Garden Club hangouts recently.
Yeah.
In our review of different scenarios, that was a specific scenario over how you have to handle it. And, it is, you've got to get the paperwork. You have to have what is the legal order from the judge. And then just go ahead and put it in the record. It's just so much easier.
Yep.
So anyway, there's a lot to do with that. And we'll go back and I'll look and see how much, because that's a constant problem anyway. There's a part of me that wants to go, it's just still more going to be a problem. There's, like you said, unless you're carrying it all around. But yeah, it's a big thing. And I think that we'll see the scenarios that they're seeing when we start to see some new enforcement actions. You touched on the HIPAA audits. And because, they started audits in December 2024. And they had some going. And they are reviewing compliance with selected provisions of the HIPAA security rule most relevant to hacking and ransomware attacks. I don't know that I saw that part when that came out, but they plan to publish an industry report summarizing OCR's findings after they are completed. And the way that went the last time, we won't see it for years. I don't know.
Maybe by 2030 we'll have the information.
Yeah, I mean, it gets buried in everything else because it's not the regular program, right? And
Yeah.
they have very limited resources now. They were covered up with work before they, let go major parts of the organization. So we'll see how it turns out as far as that goes. She did point out the breach numbers from 2025, and I don't think we need to tell everybody that it was bad.
Yeah, no, probably not.
It may be fewer number of breaches and people might get excited, but then it's more patients. So the bad guys are getting the bigger ones through, in some cases, going through the smaller ones to the bigger ones, that kind of stuff. But 76% of the data breaches reported over 500, the 500 and greater, rather, 76% of those were listed as hacking and IT incidents, specifically in areas of network servers and email. Primary part of it.
Yeah.
Yeah.
I could see that. It's I still can't fathom why people don't have advanced security on their email.
I know.
And I see it all the time. And I think a lot of it just boils down to people aren't used to having email security. I mean, I know it's been around for a while, but the consensus of people's understanding of cybersecurity lags way behind what's actually happening.
Oh, yeah.
There's still people who think, well, as long as I got antivirus, I'm good. I'm like, no, you're not. You're nowhere near good.
Yeah.
There's so many different areas you have to protect. And then, our data is no longer siloed to the computer we're using. Our email typically is cloud-based everywhere. So that has to have its own level of protection. And then as far as network servers, I mean, is it cloud servers? Is it local servers? I mean, we're seeing, we see both. And, now you've got the complexity of how do I configure this properly? Because now it's a cloud server. When you're dealing with, let's just say, Windows servers, in the past, you had a local Windows server. You knew how to deploy it. You knew how to secure it. Now, when you do a cloud server, is it going to be on Azure? Is it going to be on AWS? Is it going to be on Google? All of these are different. And so the complexity is through the roof.
Yeah, but it costs too much to do it. Well,
yes, it does. It costs too much not to do it. It's like I tell people all the time. It's like it costs a lot of money to eat well. And when I say well, I mean like healthy. It costs a lot of money to eat healthy. It costs a lot of money to be healthy. But it also costs a heck of a lot of money to not be healthy. In fact, it costs more money to not be healthy. And it's the same thing with all the cybersecurity and everything else. Sure, there's a cost to it, but there's a bigger cost to not do it.
And that's a perfect segue because she did say that. She said, in talking about the NPRMs, and she said, I hear all these complaints about the cost and the burden of the regulations, and I'm paraphrasing, but the cost of the cyber attacks that you're not preventing or at least mitigating or prepared for so that they would be less, it's going to cost more if you avoid that. And it's exactly what she was saying.
Right.
So look at that. You didn't even know you were telling everybody what she said.
And you know what? You might be one of the 1%ers that, you pay for it and you never use it. Like, never have an incident, never have anything, even though I don't know of anybody who hasn't. But, I could have a crappy lifestyle for years. I'm used to these people and yet never get any disease. But that's not, that's not the norm. That's the outlier.
You're right. It is the oddity. But at the same time.
Oh, no, I was going to change topics. Go ahead.
Okay. Go ahead. Let's go. Because
I was going to say, I'm I'm chomping at the bit to hear about the security rule changes, because all I'm seeing on LinkedIn and places is how this is, it's coming like tomorrow. It's here. Do all the stuff. Here's everything OCR is going to be doing tomorrow. And I'm like, come on, y'all.
So, when she got to the NPRM discussion, she did point out that they will soon be publishing their fall agenda. So that's when she brought that up. So I'm not looking to see, I think some of the privacy rule NPRM may come out by May, but not the security. But then she pointed out, so remember, there were 1,400 comments on that big, it was huge privacy rule changes. 1,400
in 21.
comments.
So 5 years ago.
Yeah.
Okay.
NPRM came out last year, over 4,700 comments.
So if we math that out, we'll see changes in 10 years.
I mean, because they are obligated to read each comment, and if the comments are kind of all about the same thing, they have a single response. But otherwise, they respond to each and every one of the comments is the way they do it. That would explain why, the thing comes out in January 2025, 4,700 comments. OCR offices are completely reorganized. Most of the people in some offices are gone. And you got a new director coming in, and they still got to read the 4,700. I'm like, no wonder we're not hearing much other than, yes, it needs to be done, because there's a lot of pressure.
Upload them into AI and say, give me the TLDR on this.
Yeah, there you go.
I ain't reading all these comments. Just give me the gist.
But again, she pointed out that she could not comment on the plans, but she could comment on a few things that she did comment about. And based on the discussion, I can tell you that addressable sounds like that's toast. That whole addressable thing, for the most part, will be toast. Because she said that small entities, that the flexibility was put into it on purpose because it was felt that it was needed. But many SMBs, small entities, then assume that it means it's optional.
Yeah, I just saw a post today which all but said that.
Yeah,
and
really?
I'm like, people still don't get it. Yeah,
really?
It was like today the guy posted, encryption in HIPAA is addressable. However, we should still consider doing it. And I'm like,
what?
No, that's not.
That's not what it says.
That's
Yeah.
I'm like,
Yeah. So yeah. That's why she was making that point and talking about, the cost of doing nothing is immense if you get hit. And you don't want to be in that place. It's really, really bad. And, businesses close. They're never able to come back. Patients, if you're a care provider, your patients are left just spinning in circles, which is never good. So that was her point, is the importance of information management. And she then brought up, all about addressable and why that needed to go. She brought up risk analysis and risk management requirements. And if you'll remember, if you look at it, and I did a review of all of it, and the things that are almost certain are the things you should be doing anyway. It's not new.
Yeah.
It's just they're stating it, actually putting it into words. So it's really not new. It is, the new part is it's actually telling you more about what you should be doing. But you should already be doing them. So you could do them now.
Well, the funny part is you got people so bent out of shape on these proposed changes. And then if I ask the question, well, have you done what's currently in place? And they're like, oh, no. What are you worried about?
No, you're not doing it now. What do you think you're going to do?
You're not doing it now. So, I mean, at the very least, get your house in order now. And so no matter what comes out, it's not going to be less than what you're currently doing. I can promise you that.
Yeah, that was one of the things I did with the Garden Club folks is I went through and had that discussion with them. Look, if we need to look at it and say, if we want to get the best bang for our buck, it's the things that we're already supposed to be doing. Those, make those the priority. And then there's some other things that we kind of work in or we figure out and we make plans for that are newer things. And it did turn out that when I, really ran through it with multiple models and different, because of course we're using AI for that. Here, I want you to tell me this, tell me this, tell me this.
Yep.
Yeah.
Worried about the changes. And then when you say, well, when's the last time you did a SRA? Oh, we ain't never done one.
Yeah.
Okay.
And that's why they have the SRA initiative. Yeah.
Let's start there.
Yeah. Isn't that what with this right here? The scan that IT did? No, that is not one.
Yeah.
Anyway.
Yeah, it's like you're worried about the destination and you didn't get left airport yet.
You ain't even found the flight. So
I know.
Yeah. So in that discussion, she pointed out, and I went, "Wait, what?" I was like, I wanted to hit rewind, but it was the way it was playing. Anyway. She said was talking about the SRA enforcement initiative, and how many they have 12 completed enforcement actions in that initiative. Most OCR large breach investigations reveal a lack of compliant risk analysis and thus of compliant risk management.
Yep.
So the SRA enforcement initiative is now adding risk management into the enforcement initiative.
Ruh-roh, Scooby. Well, the whole thing is your SRA has to be done properly. Otherwise, everything else you do after that is messed up.
Exactly. I mean, that's what we always say. Like if you don't do that right, nothing else will be right.
Yeah.
There you go.
It is your foundation.
Yeah. And it's like, well, really all you're trying to do is figure out what you need to focus on versus just doing stuff. And, the bottom line, it's the things that there are things that need to change for sure. But if we just did what we were supposed to be doing, and I've always said that, we wouldn't be where we were if we just always done what we're supposed to be doing. We wouldn't be here because nobody wanted to do that. It was too expensive. It's always been too expensive. Always.
Yeah. Anything you don't want to do is always expensive, no matter what the cost.
I don't have time for it. We all do it.
I mean, yeah. I mean, how many times have we talked about the fact that you can do so much of this security awareness training for free? We put out, this podcast is free and it's security awareness training, and people still go, I can't afford it. I can't afford to do security. Okay. Then we're not talking about a money issue.
Yeah. It's like I don't have time to go to the dentist. I don't like going to the dentist either.
Yeah.
This guy I know, he calls it the torture chair.
Yeah.
Yeah. So anyway, she's, bringing up that whole point, and it also pointed out that the flexibility that we get because of the things that are built into the security rule, that the AI, because then she said, and I keep getting questions about HIPAA and AI. And it's just like us. What does HIPAA say about AI? HIPAA doesn't have to say anything about AI.
There is AI in HIPAA. It's backwards, but it is in there.
Well, what's funny is her slide, and I put the slide in here, a picture of it. The regulated entities should ensure that new technologies, including AI, comply with the HIPAA rules.
Yeah. Simple as that.
Yeah. That's it. And start with the security management process of the HIPAA security rule. Oh, for example, risk analysis and risk management. Consider what access controls are in place. who needs access to the EPHI. Ensure business associate agreements are entered into before the service is provided.
Yeah.
Uh,
It's like none of that's changed.
No.
AI didn't change the process.
no. No, we don't have to. I mean, we may want to add things because of AI's bringing new things to the table about,
Yeah. It changes the risks, but it doesn't change the process,
No.
the risk management process.
No. So, I mean, she again, I can't tell you what the plans are, what we're going to do, but I mean, she focused on AI should just follow what we've been doing, and risk management is being added to the SRA, and the fact that, the point that we've heard over and over. If there's a large breach, there's a lack of compliant risk analysis and therefore compliant risk management.
Yep.
They see it too often not to do something about it. So then she says, here's all of our resources. You can sign up for this, this, and this. And, all of it's on their website. And and then she says, and coming soon, Nick Heister's risk management webinar. Because he did one on SRAs. He's done one on recognized security practices. And they both tell you what you're supposed to do. Now, it's not the most exciting video you'll ever see. But he's not talking about an exciting topic,
Right.
So he did a presentation the next day that was really focused on the cybersecurity update, specifically cybersecurity update from OCR. And net of his entire thing was most of the problems that we run into in not having things properly secured is if you just focused on the administrative safeguards rule part, just that part, including everything in it, then you would be much better off. And puts up there 164.308, right?
Mm-hmm.
And this is administrative safeguards. Boom. Done. If you just focus on this, it says you're going to have a security management process, implementation specifications that are required, not addressable.
you gonna mess me up.
So first is risk analysis. Second, risk management. Third, sanction policy. And it literally says apply appropriate sanctions against workforce members who fail to comply with the security policies and procedures of the covered entity or business associate, specifically. And information system activity review, also required. If you did those 4 things properly, a lot of the problems go away. And that's the point. So it's like it's a regulation that's burdensome, but if you did this, the thing the regulation is telling you to do is how you protect your business and patient privacy and patient safety and all of those other things.
Yeah. And I hate to tell you, but any business that you're in has to do these things.
Yes.
It's not a healthcare problem. This is just business.
Yeah.
You still have to know what your risks are. You still have to have a management plan against those risks. I mean, some industries have similar regulations. Some have no regulations, but that doesn't mean they shouldn't be doing it, because the ones that aren't doing it probably aren't in business because they're not managing their risks. It's just good common sense.
Yeah. And so, well, we know, right? So, I mean, the big point that really was brought out across both of what they were sharing is they're not raising the standard. I mean, there are some changes, but this is what the standard always was. And it's what we've been saying all along. So they don't want you to just throw some paperwork at them. They actually want you to have documentation showing that you've implemented things.
Mm-hmm.
And, there's the point of, knowing that you have a risk, you actually need to take action on it. And it's not a one-time analysis. It's a continuous management thing. These are simple at least we've said them before.
Yeah. At least 500 times.
Yeah. And on the same day that Heasters did his session at the HIPAA Summit, they published the coming soon risk management that she got to give the teaser about. And in the video, he talked about the OCR, did the SRA one, which he pointed to. And you should watch it yourself, but we do have nuggets of our own. But he pointed out that in, the OCR continues to encounter incomplete or non-existent risk analysis during the security rule investigations. It's unsurprising that OCR's investigations frequently find that regulated entities with poor risk analysis often have non-compliant risk management processes as well, because the entities do not understand the risk and the vulnerabilities. Okay, so that's pretty straightforward. And then it came up with the patterns of the investigation, and it's basically the same stuff we've heard over and over, pointing out that you problems with risk management generally fall in one of these areas. Is known risk are ignored for years, and we've heard that a lot. That the risk never changes, nothing gets fixed, there's no remediation, that kind of thing. Second is what?
Just to go back to what he said about, it's because the entities don't understand the risk and vulnerabilities to their EPHI. So to me, it's like you don't know what you don't know. The problem is ignorance. And so when you tell somebody, yeah, you can go do your own SRA, and you can, but if you don't know what you don't know, your SRA is not going to be right anyway, because you don't understand the risks and vulnerabilities. So you need to have somebody who's been there, done that, seen it across multiple clients, so they can help you identify and understand what those are.
Well, and that, that's another, we all say you don't know what you don't know. And that's one of the things that we always focus on, is saying you always have to assume I don't know that I don't know something. And somebody in one of those sessions said, you don't know what you don't know until you do know. And then once you know that you didn't know it. And I'm like, you don't know what you don't know until you know. And it was brilliant. I just got a biggest chuckle out of the weirdest thing, but yes.
That's true.
But then we have security theater or compliance theater, where you have the policies, but they've never been implemented. That's, okay, we have the risk and we're going to do these, and we don't have anything to show for the work other than we check the box. And then the third thing is we had a breach, so now we're going to panic and implement all the things that we should have done along the way.
Of course.
Yeah. You got to have evidence of it with configurations, screenshots, logs, timelines, approvals. If you had the risk, you didn't fix it, and you've had ample time to fix it, then they're pointing out that's kind of getting you into willful neglect.
Yeah, not where you want to be.
So what did he say you needed to do for risk management? Because I know you actually got more out of the video than I did. I haven't even had a chance to watch the whole thing.
Yeah, some of it talked about the exact same things that we've already covered, which step 1 is a risk analysis, step 2 is risk management plan. And of course, he emphasized it's not just a plan, it has to be implemented. You can't just say, here's my risk management plan. You got to start doing stuff. And, he's looked at it and said things like, security should address things like anticipated cyber threats and impermissible disclosures and your workforce compliance. And it also has to have ongoing review and updates of controls. It's all the same things we've always talked about. And he said that OCR investigations, they often find that the risks identified, but they were never mitigated. One of them he gave an example of, showed on the SRA like 7 years in a row, this risk was identified, but never was it ever mitigated. It's like they just did the SRA. They paid for somebody to do the SRA, and that's as far as it got. They never did anything else. And that was just one of the things they find. And apparently they find that fairly often, where the whole SRA thing is hounded on by people all the time, because that's what folks are selling you, right? It's like they're selling you the SRA. They hand you the piece of paper and they're like, all right, go do the things, because nobody wants to pay for the ongoing risk management piece of it.
Yeah.
But then you got repeated breaches exploiting known weaknesses. You know, it's not something new or novel. You know, you and I worry about 0 days. These people are just getting exploited for things that's been out for years. It's like, let's not worry about the 0 days. You can't even do the other stuff.
Yeah, you're still
they have
running.
weak authentication. So, you know, the passwords are crap. They're still using, you know, junk to authenticate. Single factor access. So they're not even doing MFA, which has been out for forever. Policies have been written, but not actually implemented, which we see all the time. It's the same stuff. So the improvements would be, get this. How about implement MFA? What? Cost you nothing, really. Turn it on. Most platforms, at least the major ones you use, already have it. Just turn it on. And I don't want to hear this whole comment about my people are too stupid to use MFA. I actually had somebody tell me that.
Really?
Like, really? You hire people and you call them too stupid to do MFA? I mean, that's kind of crazy. Hate to work for you. Network segmentation. If you don't understand what segmentation is, then get somebody who does. But all your stuff shouldn't be able to talk to all your other stuff. Understand what anti-malware and EDR is. And if you don't know, find somebody who does. But if you just think having one piece of protection on your systems is all you need and that's good enough, you're wrong. How about reducing admin privileges? One of the things that drives me crazy is like, you know, everybody in the small organization needs to have administrative rights to everything. Like, no, you don't. There's no reason for that. And that's one of the things that anybody that's doing IT should come in and start taking these things away. And it's not that, you know, you're losing control. It's that you're reducing your risks, you're reducing your attack footprint. That's what it's for. And then lastly, improve your logging and monitoring, because if you're not logging things, you're not monitoring things, you don't know when things are happening. And when things do happen, you don't have the ability to go back and figure out what happened. It's like, you know, we were breached. When did it happen? I don't know, because your logs only go back 7 days. Have no earthly clue. It could have been there for years. Who knows?
Well, that's all fair. Now, I do go ahead.
I was going to say, he did mention you brought up willful neglect. He said the penalty is now $73,011 per day per violation, not $50,000 like people still talk about.
Yeah, $1 million. Yeah. Nah.
Yeah, it's not 50, it's 73 now. So got a little raise there.
Wow.
Per incident, per violation per day. And then, of course, documentation, you have to prove that you actually implemented it. Not just policies, your documentation has to prove implementation. And then, of course, your risk management should be continuous, not a one-time activity. That's why it drives me nuts when somebody says, can you do a risk vulnerability scan and give me a report? And I'm like, no, I can't. Because you're literally asking me to do a scan that's going to do an immediate point in time, which might have been 10 seconds. So the 10 seconds out of your whole year, this is what your company looked like. No, either we're going to do vulnerability and risk management or we're not doing anything. This whole scan once a year thing is a waste.
Yeah, all you're doing is testing things when you do that.
Right.
I just tested the scan. Yes.
Yep.
So the documentation to prove actual implementation. And I heard somebody actually say, now they want us to prove we're actually doing it.
They've always wanted you to prove you were doing it.
I was showing somebody how the cool and comply assistant, you log in all the different work you're doing and it creates that timeline for you automatically. And I literally had a guy look at me and go, but then they'll know I'm not doing it.
Well, the more scarier part is the fact that you're not doing it.
I was like, okay.
I mean,
yeah.
I'd at least be able to say that, I thought I was doing it right, rather than I knew I wasn't doing it.
It was just, anyway.
Yeah. But these are the same people that want you to feel sorry for them when something happens and they can't afford the cost of, mitigation and the ransomware and all this stuff. Like, you didn't even try. Like, you did absolutely nothing to try to avoid this being an issue.
Mm-hmm.
And then when it becomes something where you're now victimized, all of a sudden we're supposed to now feel bad for you.
Well, yeah. I mean, when you have the settlements and you have the cases where they actually go and pay a fine, even then, it's like, in those cases, they didn't do the thing that would have prevented or at least made not as bad, but it's like, well, it's going to happen to me. So whatever.
I mean, I don't know what to say. It's like, if you've got a posted speed limit sign on the road, it's like where everything we're telling you is like, slow down.
Mm-hmm.
Like, we're training you, we're giving you the driver's ed, and we're doing all this stuff. And then you speed, and then you're mad because you got a ticket. You violated the law and there was a fine. Like, I don't feel sorry for you.
No. and so that, and it is hard. It is awful in every single business. I don't want to spend the money I do on securing my business, but I do.
Look, I don't want to spend the money on that. I don't want to spend the money on taxes. I don't want to spend the money on accountants. I don't want to spend the money on employees. But that's the cost of doing business.
Yeah.
Like, there's a lot of stuff I don't want to spend money on, but it's the cost of doing business.
Yep. And we just have to see it that way.
I know.
We just have to treat it that way. So, and it's one of those things that and you'll know who does this analogy. It's like when you flush the toilet, you don't know all the things that are happening. You're just glad you could flush that, right? You had to flush the toilet. And then suddenly you can't flush the toilet anymore. I'm sorry, you're not going to be able to flush the toilet ever again. Well, I'm moving out. So, but it's kind of like those protections are in place and you don't know you're using them. You don't know. And in that case, you're not paying attention until sewage backs up in your house. And, seen that happen to people.
You take for granted that when you push that lever and it just works.
Yeah.
Until it don't.
So and
nothing's worse than flushing and watching the water slowly rise higher than it should. And you're like, oh no.
Yeah, so there's a reason that you try to maintain things like this, and it's very similar. You're doing these things all the time, and you don't even realize, there's a lot happening there that needs to all happen for that to be safe.
Yes, that's right.
But yes, you're right. That terror of
yeah. And then if at the last second it finally flushes, you're like, oh, you're done. God, it was just about to be a mess.
Oh, that feeling. See, so you have that same feeling when you click on something sometimes. When you think,
I know. So
is this, oh no, is it?
I know.
Same thing.
Yep. So IT is there to make sure the crap just keeps going where it needs to go.
Okay, I think we should end on that one.
All right. Sounds like a good stopping point. All right, folks, that is our show for today. Thanks for listening. Be sure to join us again next week. And remember, for Donna and myself, that HIPAA is not about compliance. It's about patient care.
You've been listening to the Help Me with HIPAA podcast, hosted by Donna Grindle and David Sims. The show created to help you with HIPAA. For more information or to ask us a question, visit our website at helpmewithhipaa.com. Neither Donna Grindle or David Sims are attorneys, and they do not offer binding legal advice concerning regulatory compliance. The information in this podcast should not be relied upon or construed as legal advice in any way. Consult your attorney for legal advice concerning compliance with HIPAA regulations.